Hello everyone, greetings from Orthopaedic Research Group and Brew with Bones. We are back again with another new episode of this podcast series where we are going to discuss with Dr.Guna Pratheep Kalanjiam about his experience in getting trained in Singapore.
So we have with us one of young and dynamic spine surgeon who is now performing his fellowship in robotic spine in the National Healthcare Hospital groups in Singapore. So we will listen from him on his story and the pathway through which he has entered the Singapore hospital and getting trained there in endoscopic and robotic spine surgeries. So back to you, Guna. Please introduce yourself and tell us about your story from India, your residency, your working career here, and then getting there as a robotic spine fellow.
Hello everyone. I'm Dr.Guna Pratheep Kalanjiam from Singapore right now. So both Dr. Satish and Dr. Giri are well known to me right from my post-graduation days, and we all belong to the same batch and we did our post-graduation together. I'm very happy to join the meeting with them. So I did my post-graduation in Madras Medical College from 2016 to 2019. So after that I cleared the F&B exams, Fellowship National Board exams, and did my F&B for 2 years at Ganga Hospital, Coimbatore, following which later I joined there as a registrar for another 1.5 to 2 years there. I then post-fellowship on my registrarship, I moved back to my near my hometown, that is near Madurai, where I joined as an associate consultant in spine surgery at Meenakshi Mission Hospital. In the meantime, during my position as associate consultant, I completed endoscopic spine surgery fellowship from Seoul, South Korea. And after that, I just wanted to do another fellowship where I can improve my skills in minimally accessible surgery and robotic technology. So I pursued my fellowship here in Singapore. Yeah.
That's an interesting and an amazing journey from Madras Medical College to Singapore right now. Guna, can you say us about what are the entry pathways to get trained in Singapore?
The institutions which offer fellowships in Singapore can be broadly categorized into 3 groups. That is National Healthcare Group, National University Hospitals, and Health of Singapore. So these are the 3 major institutions through which you can gain into fellowship into Singapore. And the minimum fellowship which you can do while entering through these pathways is minimum a period of 6 months or 1 year. Most often they want a fellow who works in the place for 1 year. So a short fellowship like 1 month or 2 months through these universities or through these systems is very less possible. But still through other fellowships like APSS fellowship and other pathways like AO Spine, all these other pathways can guide you to these places for a short-term fellowship like 1 month or 6 weeks. Otherwise, when you have to enter Singapore through these major pathways, it takes a minimum of 1 year at least, and some places 6 months also. Yeah.
Okay. So to get into these 3 hospital networks to get trained in Singapore, what are the basic criteria they set forth to us, or is there any exams to clear to enter into these fellowships?
Actually, there are no exams to clear, but you should have a strong CV. Seats are also very less limited. In my place, there is only one fellowship for 1 year actually. So the seats are very limited. So they select and scrutinize the candidates based on their CV. You should be supported by good research activities and good presentations at national, international conferences. You should be academically strong. Once you are scrutinized through the CV, then they go to the second step. They check whether you are already trained or experienced in the specialty you choose. That is, if I am to enter spine surgery, robotic spine surgery, they already see my expertise in spine surgery, what I have already done in my native country. For example, in my fellowship period and my registrarship period, how many cases I have done, what all work I have done. Based on that, they then call you for an interview. It is usually an online interview where you have 2 to 3 specialists in the particular domain which you are selecting. They put questions to you. Just interview yourself just like a normal interview in any other exams. They test your clinical knowledge also. They post several questions like how to manage such a patient with spinal trauma, what are the common approaches, tell me the approach, and very basic questions, and also some advanced, what are your aims of the entering this fellowship, what do you exactly want from this fellowship, and they give a basic outline like how it will be. So after clearing these 2 steps, if they are satisfied with your performance, then they select you for the fellowship. You literally don't have any exams per se, but a strong CV with good spine experience or whatsoever experience before and the interview, then you get selected.
Okay. one point about the experience. You said you need some background experience on spine surgery. So if I'm an aspiring postgraduate who just completed, how many years of experience am I looking after to get into Singapore?
Actually, it's not like years of experience. Even after post-graduation, if you have done a reasonable amount of work in spine, for example, what they look is any spine conferences, global conferences you attended, any national presentations which you have made, research publications in high impact journals. All these are the things they consider actually. It's not about the years of experience, but my gut feeling is that many institutions here, they don't prefer candidates just after their post-graduation.
Okay.
As far as I know, and my colleagues out here, most of us are at least trained 2 to 3 years in spine before we get selected. So they expect somebody to be experienced before, because Singapore is mostly, all the subspecialties here are a bit advanced. There is no fellowship for basic spine training here. The place where I am training, they do all in and out cases with robo. There is no single case without a robo or navigation in this place. So they expect you to be already trained with basic freehand pedicle screws, basic knowledge about the pedicle screws, to be further enrich your knowledge in robotic or MIS, spine surgery or whatsoever field. Yeah.
Okay, that's great. I know that Singapore is a very costly place to live. Are you supported in this fellowship training periods, and how much is your pay in the hospital, and how are you meeting the ends?
Of course, Singapore is quite expensive, and it's very difficult and challenging to survive here with the family back home and meet the expenses back in the country as well as here. Luckily, fortunately, I'm paid a stipend here in the hospital where I work, but the stipend is quite less compared to the standards of Singapore. My stipend here is around 2,500 Singapore dollars. But if you see the expenses which I have to meet up, the residency around the hospital which I stay itself will cost around 1,500 to 2,000. Very basic setup where I can I can stay as a single person, as a bachelor guy. The normal room itself will minimum cost 1,500 Singapore dollars if you have to stay around the hospital, in and around where we can travel within 15 to 20 minutes. But if you are willing to stay far off, then it takes a lot of travel time. You have to travel at least 45 minutes to 1 hour. But you have good public transport here. Metro trains and buses are very frequent here. But to meet up the expenses, it's quite difficult, and the stipend paid here also is quite less compared to the standards of Singapore. Yeah.
So from what I hear, a bachelor life is somewhat okay, but you cannot support a family there in Singapore.
Exactly. It is very difficult to be with your family entirely at this place, because the main expenses will be in your housing and stay. Otherwise, food and everything will be quite affordable and cheap, I guess. But the housing allowances and the tax, the house also not just, it just comes as a house. If you want a TV or Wi-Fi, all these are additional expenses which you have to bear. The cost like 1.5, around 1.5 to 1.8 is just for the house. But you definitely want an internet connection. You definitely want other allowances like for watching everything. So it is quite expensive here.
Okay. So depending upon your experience, can you say how far are you getting exposed in those programs? What is your cutting chance there?
Actually, so far, the cutting chance and the exposure has been so good for me. It mainly depends on the mentor whom you choose, actually. I feel so. It is mainly based on the mentors whom you choose. The mentor will definitely give you the cutting chance if you could assist him in the pre-op planning sessions, and he will just test your knowledge. Before every case, my mentor used to tell what will you plan if you are treating this patient back home in your country, where will you put the pedicle screws, and all this stuff will be planned the day before surgery. And as the training which I am undergoing is mainly based on robotics and minimally invasive surgery. So the robotic software planning, everything goes on the day of surgery before the patient comes to the operating room. So based on all your efforts you put in on all these planning sessions and patient care, we usually call him the boss here. It's not the tagline which we call our professor is boss. The boss usually gives the chance based on your involvement in the case. But you get to be exposed to all kinds of pathologies, like ranging from trauma, degenerative tumors. You get to expose to everything in spine. But majority and chunk of the cases here is mainly degenerative. Trauma is quite less. Overall, in the incidence of trauma is less in Singapore. So you get to operate less on spine trauma patients.
Okay, so from what I hear, the interest we show gets us the chance.
Yeah. And one more thing I wanted to add, the cutting chance is not like you will be handed over the whole surgery from skin to skin. It's not like that. He will be with you throughout the surgery, and in between the critical steps, once you are accustomed, the first 1 or 2 months, you won't be able to get the chances. You just to know the system, how the system works. And the medico-legal litigations are quite high in Singapore. Even a small bit of error during the surgery puts a lot of allegations on the doctors and the medical fraternity. So they are concerned about that also. So only when the boss is confident with your work and your performance, he gives you the chance. Yeah.
Okay. So speaking of volumes, like what is the volume of surgery that happens in your center compared to the ones where you previously worked? Say for a Ganga, for example, is a high volume center. What do you consider your center compared to our native centers?
Compact in general, not just my center, as I have seen many colleagues from different hospitals in Singapore, the overall number of surgeries which we perform in my hospital where I'm working or in Singapore is quite less compared to the Indian setup, especially a hospital like Ganga where the volume is quite high. The volume cannot be expected so much like our place. Maybe on an average you can say around 6 to 7 cases per week. That is one case per day. And the place where I'm working is I particularly assigned with one consultant, but he get to operate either 2 or 3 days a week. So the remaining days, if I am willing, I can go and help other surgeons and go to the OR. So if I am to assist only my surgeon, the caseload will be further less.
So if your boss is busy, you are busy.
Yeah, exactly. Yeah.
Okay. Fine.
But there are several centers in Singapore where, for example, National University Hospital is one of the hospitals in Singapore where they do a lot of deformity cases. Same in our country, during the winter vacation, patients with scoliosis get operated a lot. Same happens here. During the vacation season or some festival or leave, then cases gets piled up and you get to operate more cases. On an average, if you got to ask me, the volume is very less compared to India. Yeah.
Okay. So, since your center is mostly focused on degenerative conditions, do you also follow along a waiting list like that of the Western countries, or it is a day in, day out kind of scenario?
You are right. You are definitely right. There is a waiting list for not just the surgery, even for the MRI in a private setup, you have to wait. And in public setup, in the hospital where I'm working, the waiting period for an MRI itself is around 2 to 3 months actually. It's not like you walk into a hospital, take the MRI and just come out. Because even the general hospitals don't give free treatment. They provide subsidies to the patient, but nothing is free of charge. At least few, not like the general hospitals in our country where we treat the patients freely if they are attending surgery, we have government insurance covering. But here, government take a part of the money, but not complete free of cost to the patient. So the waiting time is also quite high. It's like 2 to 3 months for a degen condition. Unless it is a dire emergency like carda equina, you get admitted and operate the next day. All other conditions need a waiting period of at least 2 to 3 months.
Okay, that's a good information.
So Guna, you have given us a detailed information on how your training is, which will be very valuable to the listeners. When an orthopedic surgeon or a resident wants to get trained in Singapore, where should he look at? Is there a Singapore Orthopaedic Association website which enlists various fellowships available from which he can choose, or should we approach different databases, for example the National Healthcare Group Hospital's own website or the National University of Singapore's own website? Is there a website with the collective information?
Yeah. As you said, it's the website of the institution which you have to look out, and there will be options for fellowships where you can apply. It's not through the Association of Singapore, not through the Orthopaedic Association. It's through the university's specific websites through which you can enter. Yeah.
Okay. So how is the social life there?
Social life is quite good here. We get to see a lot of new people. Actually, Singapore seems to be a multinational place where you get to see people from Malaysia, China, India, and also European people. So the social life is quite good and busy here. You get a lot of new experiences. And food is also easy for Indians to accustom, I feel, because you have many Indian food stalls around, and you get mainly chicken, and seafood is quite popular here. So otherwise, social life, it's quite expensive, but on the expensive side, if you see, it's quite expensive. But if you are willing to pay out of your pockets, it's definitely going to be a great time for you in Singapore.
How is the work life there? Are the weekends both Saturdays and Sundays, or only Sunday?
Actually, it is Saturdays and Sundays, but in my specialty being spine, we need to see patients on every day, and also my Friday is an operating day for my boss, so we have to go to the hospital on Saturday also to do rounds in the morning and do the post-operative workup and stuff like that. So it will be mostly a chill kind of day. Saturday is half day maybe. Sunday is definitely free unless you have an emergency. In spine, any trauma case admits or carda equina, he'll just call me on call. It's like on call. You just go on Sunday. Most of the time, Sundays will be free. Yeah.
When does the day start on a normal working day, and when does it end?
So the rounds in the morning starts by 7:30. So 7:30 to 8:30 will be the rounds, after which the clinic starts by 9 o'clock if we are in the OP. Clinic starts by 9 and it runs till the afternoon 2:33. post which you have to do a rounds again in the evening and then get back if it is a clinic day. On OT days, the same 7:30 the round starts, finishes by 8 and you have to head to the OT, and depending on the duration of the case, 1 or 2 cases per day will be what the schedule will be like. This 1 or 2 cases, it will take till 5:30 in the evening, and then again the post-operative rounds and then pack up. It's like 7:30 every day in the morning till 6 maximum in the evening.
So everyone who graduated in orthopedics in India can apply there, or is there any restriction on the university?
I don't think there is any restriction. I don't think there is any restriction. Anybody who has finished orthopedics, and more specifically with prior knowledge and experience in the subspecialty which you are willing to train, will add an advantage to you compared to just a fresher applying to Singapore. Yeah.
How is the research scope during the fellowship? Are you exposed to research there? Are you specifically assigned some thesis during your fellowship time?
Yeah, they do give a lot of importance to research work here. And as the hospital where I am currently is also associated with the medical college, so we have students also attending the clinics and all such kind of stuff. So being quite a senior in the subspecialty where I am working, my boss has given me a job to guide the juniors and to take part in their research and do my own research also. So it's quite useful to do a research work here also. Yeah. There are many research labs here also, and if you're interested, you can just go and visit also during the period of fellowship here.
When you apply, how many publications are you expected to have on a minimum?
I don't think there is a criteria like minimum publications. It's like the topic on which you have published matters, I feel. Whether it is a current topic and whether it is relevant to the current scenario, and what is the impact of the journal in which you have published. All these are taken into account, and the place where you are trained also, some surgeons give importance to that, which place you are trained in your post-graduation and your fellowship. That also plays a role actually. Yeah, it's not like the number of publications, it's the content which you have published that matters.
Okay. Is there any criteria like you need 2 letters of recommendation or anything like that during the application process?
No, they didn't ask me any letters of recommendation. It's just based on pure work previously. No letter of recommendation is needed. But during the paperwork, for the selection process, I don't need any letters. But after I get selected, it is a long waiting period. It's not like you immediately get into the fellowship after you are selected. Once you are selected, then they'll mail you when you can join. It will be, for me, it was like I applied for last year, and I got to be selected this year. So there is quite a long waiting period also. During the waiting period is mainly for the paperwork, and the paperwork will be a stepwise process, and it will be a long and tedious paperwork actually. It will not be a single shot, you submit all your documents and you get selected. It's not like that. So during that period, they will definitely ask some letters from the previous place where you have worked, but not for the selection of your fellowship.
Okay.
How is the vacation? Are you having a 1 month vacation for a 12-month fellowship, particularly if you are going from India, you'll like to come back and visit your hometown at some point of time?
Yeah, actually, for as you said, for if you are doing a fellowship for 12 months, that is 1 year, you have 12 days or 14 days of vacation. You can take the vacation, after which there will be loss of pay as I am paid stipend actually. So depending on the duration, for 1 year it is 12 days of vacation. Yeah, and you get to, as Malaysia is quite close by here, you can even take a road, car or cab to travel to Malaysia. So Malaysia, Indonesia is half an hour to 45 minutes by flight. So all these are places which you can visit. And from Singapore, the flight tickets are also quite cheaper compared to flight tickets from our place.
Okay, so if one is planning to settle down in Singapore after the fellowship, so what are the options?
You can definitely settle down after the fellowship in Singapore, but you have to again start it's not like you finish the fellowship and join immediately into their system. Again takes a lot of paperwork. You have to convince your boss needs to recommend you to continue a fellowship, continue the work you are doing here. And based only because the Singapore Medical Council will just approve for continuation only after your institution approves that this guy is capable of continuing and is a valid input to our system. So your boss needs to, or you should be in good books of your boss and the people around you. And it takes a lot of paperwork, and sometimes they ask for FRCS also if you are planning to continue for long term.
Okay. So is it a mandatory to have FRCS right now, or it's an optional thing?
As far as I know, most of the centers, if you want to continue from India, they ask for, but I'm not pretty sure about it. But as far as I have heard, MRCS or FRCS is most of the centers are asking, yeah.
Okay, so it is based on the center where we are trying to continue on the long term.
Yeah.
Right?
because most of the residents who are practicing, who are natively from Singapore, have the FRCS degree with them. So I feel like it is mandatory in Singapore to have FRCS or MRCS to have a practice in Singapore.